This is Ethan Moore. I'm going to be demonstrating my physical assessment checkoff. First, you would start by introducing yourself to the patient, performing hand hygiene, explaining the procedure to the patient, and then providing utmost privacy. Only keeping parts just exposed that need to be exposed, and keeping parts that don't need to be exposed draped. First, you're going to take an overall general appearance of overall look at the patient. You're going to check, are they dressed appropriately for the outside weather? Do they appear hygienic? How old they are? And then you're going to be sure that they're alert and oriented times 4. So, how old are you?
16.
Okay, and where are you?
I'm at my house.
What year is it?
2020.
And who is the current president?
Donald Trump.
All right, and he appears alert and oriented. He appears dressed appropriately for outside, and he does appear hygienic. So, first, we are going to assess the head. We're going to palpate all the way around for lesions, masses, bumps, anything like that. And we're going to ask if they have any pain or tenderness. Do you have any pain or tenderness?
No.
Okay. Then we are going to test range of motion for the head. So can you touch your right ear to your right shoulder? Okay. Left ear to your left shoulder. All right. Put your head back and chin up. All right. And then chin down towards your chest. All right. And he seems to have free range of motion. Next, we're going to check the patient's eyes. His eyebrows and eyelashes are present and they're full. And they appear symmetrical. So we're going to check, be sure you have on gloves. You're going to check the conjunctiva and the lacrimal vessels. You're going to check to be sure that the eyes are, the sclera of the eyes are white and clear, that their pupils are 3 to 5 millimeters, and his appear to be about a 5, and that his irises match his chart, because if not, it could be indicative that the patient would have a prosthesis or wear color contacts or glasses, and you should always ask that before you start. Next, we are going to check the third cranial nerve, which is, the second, the optic cranial nerve. And normally you would do this with a Snellen chart, but since I don't have one, I'm going to have the patient follow my pen light in towards his nose. So can you follow my pen, please? All right, and he does that with ease. Next, we're going to check the cranial nerve 3, which is oculomotor with the 6 gazes. So follow my pen light up, down, please, up, and down, up, and down. And he can do that, no problem. Next, we're going to do cranial nerve number 4, which is the trochlear, which is going to be up and down movement. So again, one more time, up and down. Then we're going to check cranial nerve number 6, which is abducens, and that's going to be from side to side. And he does that no issue. Now we're going to move on to the ears. You would check exterior first to be sure that the pinna and the auricle are intact, no tears, rips, or lesions. And you're going to palpate for any tenderness. Do you feel any tenderness?
No.
Do the same on both sides. Okay. Then you would use your pen light to check. Normally you would use an otoscope, but since I don't have one, I'm going to use my pen light. Check on both sides for any redness or drainage. He doesn't appear to have any. So next we're going to move on to the nose. No, I'm sorry. Before we move on to the nose, we're going to do an acoustic whisper test to test cranial nerve 8. So I'm going to occlude one of your ears, and I need you to repeat me what I said. 2, 4, 6.
2, 4, 6.
Okay. And other side? 8, 10, 12.
8, 10, 12.
Okay. Can you remove your mask for me, please? Okay. To inspect the nose, we're going to be sure that the nose is symmetrical and midline. And again, we're going to do an occlusion test. Palpable test. We're going to close one nostril with one of our fingers. The nose is symmetrical and midline. Okay. So can you breathe in for me? He does that with ease. And one more time. Okay. And you can breathe just fine out of both sides. Next, we're going to move on to inspect. No, we're going to do test cranial nerve number 1, which is olfactory. So, can you close your eyes for me, please? All right. Can you smell this and tell me what it is?
Peppermint.
Correct. It is peppermint oil. All right. Next, we're going to check cranial nerve, cranial nerve number 5, which is the trigeminal nerve, which tests sensation. So, close your eyes for me again, please. All right. And where am I touching you?
My right cheek.
Okay. And now.
My left forearm.
And he can do that just fine. Before we move on, we're going to do cranial nerve number 7, which is the facial muscles. So can you smile big for me? Frown big? And puff out your cheeks like a fish. Okay, you can do that easily. Now we're going to inspect the mouth. So can you open your mouth for me, please? First, his lips are pink and moist. There's no cracks or lesions. So then we would inspect the inside. Okay, lift up your tongue for me. All right. And he does appear to have all of his teeth. There are no signs of inflammation or redness. He doesn't have any thrush on his tongue or the back of his throat, and his tonsils aren't swollen or have drainage from them. So, and his uvula is midline also. You would want to be checking for dental devices such as dentures or partials or even braces. And then you would also want to check for white spots on the mouth, which could be indicative of cancer or tobacco use. And thrush also. Next, we're going to test the cranial nerve number 9, which is the glossopharyngeal. So I'm going to test your, I'm going to be sure that your uvula moves up and down. So I'm going to depress your tongue. Open your mouth for me, please. Oh, sorry, use my pen light. Say ah. Okay, and his uvula moves up and down just fine, and it is midline. Then we're going to do cranial nerve number 10, which is the vagus nerve. We're going to do a swallow test first, so swallow hard for me. Okay, open your mouth big. I'm going to test your gag reflex. Okay, his gag reflex is intact. Next, we're going to do the cranial nerve number 12, which is the hypoglossal. So stick your tongue all the way out for me. Move side to side. All right, and he can do that with ease. So can you put your mask back on for me, please? Next, you would inspect the throat to be sure that the trachea is midline and that there's no tenderness. So first, you would palpate after you check for the trachea to be midline. You feel any pain or tenderness?
No.
Okay, and next I'm going to palpate the lymph nodes. They start at the base of the neck. I'm just going to move all the way around, gentle circular motions, all the way down the throat, and to the clavicles. Feel any pain or tenderness?
No.
Okay, and then next for the throat, we are, I'm sorry. Oh, I'm sorry, yes, okay. So, can I get you to lay down for me, please? I'm going to have you turn your head at a 45-degree angle. And then right here, we're checking for jugular vein distension. And if they have any, then it could be, if it's poking out or swollen, the vein right here, it could be indicative of heart failure. And you want to have the patient laying down for this part of the exam. Okay, you can sit back up for me. You'd want to remove your gloves before you start the next part. You're going to be feeling for all the pulse points, and we're going to start with the temporal pulse points, which is on the top of the head. You want to be barehanded for this. On both temples, you're going to check the temporal pulse, the carotid, the brachial pulses, and the pits of their elbow are in the antecubital fossa. Their radial pulses, popliteal on the back of the knee. Okay. Their dorsal pedis, which is on the top of the foot, right behind the toes. And their posterior tibial, which is in the groove of the ankle. Also, the femoral arteries, which are up here on the top of the thighs. And for the carotid artery, you'd want to listen to the carotid artery with the bell of the stethoscope. So I'm going to do that now. You want to listen in 3 different spots. And you're listening for bruits, which is like a rushing sound. Okay. Then I'm going to reapply gloves. Okay. Then I'm going to inspect the thorax, which I just need you to breathe in hard for me a couple times. Breathe in and out. Okay, and we're just looking for symmetrical rise and fall of the thorax to be sure that he's breathing evenly. And then we're going to palpate for tenderness or masses. I'm sorry, I can't get regloved. So we're going to palpate the chest for tenderness, masses, anything like that in a circular motion. Do you feel any pain or discomfort?
No.
Okay. You would also inspect the skin for lesions, anything like that, rashes. All right. And then we would palpate the abdomen. So can I have you lay down for me again, please? You want to have the patient lay down for this also. First, you would check for the general appearance. Again, the skin, check it for any rashes or lumps, and then you would want to divide the we divide the abdomen into 4 imaginary quadrants: the right upper, right lower, left upper, and left lower. And when palpating the abdomen, you would want to inspect first, then you auscultate before you palpate or percuss. Because if you don't, then you could create bowel sounds that would not have been there before. You would listen in all 4 quadrants, and you would be sure that you hear bowel sounds in all 4, and if not, then you would need to listen for a full 5 minutes before you ruled out. And he has bowel sounds in all 4. So next we're going to percuss. We're going to be looking for any hollow or dull sounds. We're going to use the pads of 2 of our fingers and 2 of our other fingers to percuss. We want to be sure that they sound the same on each side. Okay, and it does. And now I'm going to palpate with in a circular motion, all 4 quadrants. You feel any pain or tenderness?
No.
Okay. And before you would do the abdominal exam, you would always ask the patient before if they had to bleed. Okay? Can you sit up for me, please? Then we would do we're going to start by inspecting the lungs. We're going to auscultate the lungs. We're going to do at least 8 points on the front. Okay? You're going to listen with you're going to listen to 8 points on the front and at least 10 on the back, and you're going to listen with the bell and the diaphragm of the stethoscope. You're listening for normal sounds such as a soft, breezy inhale and a blowing exhale, and also abnormals, which would be I'm sorry, a pleural rub sound, any crackles, or swooshing sounds. Okay. We're going to start up here. In and out for me, deep breath. You're going to move across and then down. So, okay, I'm going to go to point 2. Deep breath for me. Again. Okay. Again. Okay. One more time. And one more time. Okay, and I'm going to go back and do this with listen with my bell. Okay, in deep breath. One more time. Okay. 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 And one more time. Okay. All right. Then you have the patient sit up for you. You would inspect, normally you pull their shirt up or expose their gown, and then you would have the patient lean forward, and then you would inspect their spine to be sure that it was symmetrical in midline, and that there was no curvature, and then you would start to auscultate. Okay, in deep breath for me. And you're moving in the same pattern we did before, over and down. Okay, one more time. 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 Okay. One more time. One more time. And last time. Okay. I'm going to go back and do listen with my bell. Okay. One more time. Okay. 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 And last time. All right. He has good clear breath sounds, strong and deep. Next, we would be sure that we're checking the integumentary system all over the exam. When you're doing the exam, be sure that you're checking their skin for any scars, lesions, incisions, especially on the abdomen that could have been indicative of surgeries in the past. So you could ask the patient about it and get a more clear medical history. Next, we're going to move on to the heart. We're going to auscultate the 5 points, which is apical, pulmonic. They're both in the second intercostal space. Urbs point, which is in the third. The tricuspid, which could be in the fourth or fifth. And then the mitral valve, which is going to be mid-clavicular down the line of the nipple. So we're going to start those, listening with the bell and the diaphragm. Okay, so we're going to follow this sternal notch right here. We're going to find the second intercostal space. Okay, then we're going to move to the pulmonic pulse, which is directly across from it, same intercostal space. We're going to move to Erb's point, which is in the third. Then we're going to move to the tricuspid, which could be in third or fourth intercostal space. And then the mitral, which is mid-clavicular down the line of the nipple. And this is the point of the apical pulse, or the point of maximal impulse. You would listen here for a full minute to get their heart rate. Then you would go back and do it with the bell. There's the apical right here, pulmonic, Erb's point, tricuspid, and mitral. And the S1 heart sound would be the contraction of the mitral and tricuspid valves, and the S2 sounds, which is the dub vent, would be the contraction of the apical and pulmonic pulse points. All right. Now I'm going to remove my gloves, and I'm going to palpate the sinuses because I forgot to do that before. So could you remove your mask for me, please? Okay. First, I'm going to palpate the frontal sinuses, which are right above the eyebrows. So do you feel any pain or tenderness?
No.
Okay, I'm going to do the ethmoid, which is on the nose. Feel any pain or tenderness?
No.
Okay, what about maxillary?
No.
Okay, you can put your mask back on. Next, we're going to move to talking about breast exams, and the male and female. For the female patient, you would have her first sitting down with her arms at her sides, and then you would just inspect for natural contour, just inspect if there's any lumps and the venous pattern. And then you would have her assume another position, which would be standing up and hands straight out or above her head. And then you would just gently palpate there, and again check for contour. And an older patient, their breast tissue would be nodular and stringy, and in a younger female patient, it would be elastic and firm. For a deeper breast exam, the physician or healthcare provider would, or nurse would have the patient lay flat on her back on the exam table with a pillow under her left shoulder and her left arm above her head. And they would start at the nipple and work in a circular motion to palpate, checking for any masses or lumps. And then they would repeat the process on the right. They would also palpate the axillary tail, and the tissue should be much the same as the breast tissue. For the male patient, it's much the same in that you don't have to have them lay down, but you could start at the nipple and in a circular motion, work your way around, palpating for any lesions or masses or bumps. The breast tissue for a male should be slightly firm, but still a little bit soft. And enlarged breasts in younger men especially could be indicative of steroid use. Next we're going to move on to discussing genitals. And for the genital exam of a female, you would want to have them in the dorsal recumbent position with their legs up on the table or in stirrups. And you would inspect the labia majora and minora both for any lesions, cuts, scars, tears, and then or rashes. And then you would inspect the urethral opening and the vaginal opening both. And you'd also check for even distribution of pubic hair, and you would inspect the clitoris also. For male patients, you would, if they were uncircumcised, you would retract their foreskin, and then you would inspect the shaft, the glans penis, and the scrotum for any lesions, scars, edema, especially in the scrotum. You'd want to palpate the scrotum, having them sit down or standing up, either one, to check for any swelling or edema. And when you were done inspecting the penis, you would need to put the foreskin back in its natural position before you were to stop, to be sure that it would move back and forth freely. And I'm just going to check and be sure I didn't forget anything. Oh, one did forget, I'm sorry, is to check the patient's balance. So could you please stand up for me? Could you hold your arms out? Back up a little bit. Sorry. Okay, I'm going to push against your arms. Close your eyes for me. Okay, and he does have good balance. Next, I'm going to check cranial nerve number 11, which is the spinal access nerve. So I'm going to put my hands on your shoulders and shrug against my resistance as I push down. Okay, and he does have good spinal access. Now, close your eyes, keep them closed. Arms out again. One more balance test. Pick your right foot up. Okay, put it back down. And left foot. Okay, and he has good balance. All right. Oh, we're going to check the hands also. You would touch each finger to the thumb. And one more balance test, you're going to follow your own finger into your nose. So straight out, into your nose. All right. Thank you.